The extremities. During infancy, the extremity appear relatively short. Until puberty, the rate of the growth of the extremity, particularly the lower, exceeds that of the trunk. At puberty, the rate is about the same. The feet of the infant are flat and the legs are bowing until bulking has been established. System examination of the extremities for sign of request. Epiphyseal enlargement at the wrist and ankle, bowing deformity, gynovirus, Marfan sign, transverse groove, and medial and lateral malleus. And clapping of the finger. Ask the child to oppose both thumbnail. Normally, the small diamond shape opening is visible. If there is clapping, no space in scene. Stage of clapping. 4 stage. Stage 1, obliteration of the angle and filling of the nail bed. Stage 2, increase convexity of the nail leading to barrel beak appearance. Stage 3, drumstick appearance. Increase bulk of the soft tissue at the distal phalanx. Stage 4, pulmonary osteoarthropathy. As stage 3, swelling of the distal end of the radius and ulna. Cause of the clapping: cyanotic heart disease, congenital heart disease, chronic suppurative lung disease like bronchitis, emphysema, lung abscess, chronic liver disease as cirrhosis, infective endocarditis, intestinal bulbosis, cystic fibrosis, and commonly familial. Carbopetal spasm due to tetanus, especially in the rickets infancy. In the ricket infant, carbopetal spasm. Down syndrome, there is short finger, maybe incurved little finger, clinodactyl, and single palmar crisis, seminal crisis. The feet in the Down syndrome show wide gap between the first and the second toes with longitudinal crisis in the sole extend from the space between the first and the second toes. Almarasmus. Extremity appear stick-like due to severe muscle wasting and loss of subcutaneous fat. Edema. Edema of the both lower leg in the heart filler. Edema of the kwashiorkor, not dermatosis. Edema is caused by excessive fluid in the subcutaneous tissue. To check of for beating edema, brace firmly but genitally with ball of the thumb for 13 seconds. Over the dorsum of the each foot, over the medial malleus, on the tibia on each side, and over the shin. Look for beating. Depression caused by pressure from by thumb. Normally there is no causing of generalized edema. Nutritional as kwashiorkor, renal as nephrotic syndrome, cardiac as congestive heart failure, familial fulminated heart failure, or cirrhosis. Cause of localized edema, local inflammation, allergy in neurotic edema. In infective endocarditis, osseous and splinter hemorrhage in the addition to clubbing are seen in subacute bacterial endocarditis. Osseous nodes are small, tender, erythematous, transit skin lesion, character of bacterial endocarditis. They are present in the bed of the finger or the toe and in the palm of the hand or sole of the foot. They are due to infected embolus. Splinter hemorrhage, longitudinal red line resemble small splinter under the nail. They are due to hemorrhage from capillaries. Joint problem in the children are either primary or secondary. A common primary arthropathy in childhood is juvenile chronic arthritis. Joints are also involved in septic arthritis. Trauma, malignancy, systemic problem may be present with arthropathy as rheumatic fever, collagen vascular disease, leukemia, septicemia. To examine the joint, usually limb in the question. Expose the arm or the leg. You will look, feel, move the joints that are examined. Inspection of the joint, swelling, redness, muscle bulking, abnormal position of the joint, and subcutaneous nodule. Palpitation of the joint, palpate the joint of the affected side as well as the joint on the opposite side. Examine for tenderness, hotness, movement of the joint. Orthogonal test and Barlow test. Barlow and orthogonal test. The newborn hip should be routinely examined for congenital hip dislocation. Bilaterally test for presence of dislocation and dislocated hip. Barlow test for intact but unstable hip. The baby should be relaxed for the two tests.